And as additional cases are confirmed, we're really starting to learn more about how the virus affects people differently. Our Tiffany Tarpley takes us through what this means for Ohio's younger demographic, but also what this means for Ohio's projected number of cases.
After days of isolation,
you okay?
Olive Persimmon is still
that's okay. It was, good for me to take my cough break.
feeling the effects of a suspected COVID-19 diagnosis. The 33-year-old Stowe, Ohio native and former Kent State University student is an author in New York City, unable to get tested. But her doctor...
And she basically was like, if your breathing gets bad enough, call us back or call 911.
Her symptoms turned to extreme fatigue, a cough, mild fever, and losing the ability to taste and smell. She's grateful to be able to fight it and not be in the hospital.
I have heard about young people dying, and that's terrifying.
We have seen, I think, a higher rate of hospitalization in some of those midlife ages, the 30s, 40s, and 50s, than they did in China.
But University Hospital's pediatric infectious disease specialist, Dr. Amy Edwards, says the reason why is unknown. So she's working with others to learn more.
From the early days, there was still mortality in those younger age groups. We just didn't focus on it because of how huge the mortality rate was in the older group.
There are models that show at its peak, Ohio could see up to 10,000 new cases of coronavirus per day. Dr. Edwards says those models can vary when fewer patients are being tested.
The modeling is only as good as the data that you have.
Overall, what we have seen are young people being hit hard too. Cases like 38-year-old Nick Brown, who recovered after being in the Cleveland Clinic ICU, to Olive, who is battling symptoms at home.
I'm very lucky, and I count my good graces for that.
Tiffany Tarpley, 3 News.